How's it going? Dr. Steve Graef here, owner and founder of Mindurance and a licensed counseling, sport, and performance psychologist. So happy that you decided to take a moment and watch this video on mental health, as well as for me to introduce myself and the Ask Dr. Steve initiative. A little bit of context here to help explain what it is that is going on. First off, as I mentioned, I am a licensed sport and performance and counseling psychologist, which means I have worked with a lot of individuals, a lot of coaches, a lot of athletes at the high school, college, even professional level on further managing their mental health. And a little bit ago, I was asked to partner with child and adolescent behavioral health because child and adolescent behavioral health does a lot of mental health care locally in the Stark County area to a lot of the local schools. And they were finding that they were getting a lot of questions from coaches and athletes and parents of athletes on how do we manage the mental health of these athletes. And athletes are a unique population, which I certainly know. Not only am I a licensed counseling, sport, and performance psychologist, but I was a student athlete myself. I went to Lake High School, born and bred Uniontown, Hartville, graduated in 2000 from the Lake Blue Streaks. Went on to The Ohio State University, where I was a walk-on football player there for 4 years. Won a national championship in 2002. Go Bucks, OHIO. And what's interesting, I went on and got my PhD in counseling psychology from the University of Akron, but eventually went back to The Ohio State University, where I was a sports psychologist there for 5.5 years, working with the student athletes and coaches on managing mental health and maximizing mental performance. So I'm pretty equipped to talk about these things, but now I actually own my own practice called Mindurance. And so when child and adolescent behavioral health reached out saying, hey, we have some questions and we were wondering if you could be a resource, I wanted to jump at the opportunity. So here I am. So we thought maybe a cool way of me being able to offer some guidance to parents and coaches and maybe even athletes is to start a little Ask Dr. Steve column where I can provide you a little video with some homework and reflection exercises to provide just little snapshots of some content that hopefully might be able to answer some of your questions and address some of your concerns. But before we get into some of those questions and before we start to introduce some of these topics, the first thing I want to do is just lay out what I believe mental health is. And with that, some of the various questions and resources that might come up when we discuss mental health. If you think about mental health is not mental illness. Mental health is this whole continuum of mental wellness that occurs from struggling to stressing to striving. All right, struggling, stressing, and striving. And mental health in and of itself is just a person's regard into their psychological, mental, and emotional well-being, their psychological regard and the condition in which their emotional and mental and psychological well-being is. And so it's not saying that you automatically have a disorder, that you're struggling. It is the entire continuum. And so when I work with an athlete, when I talk with a coach, when I talk with a parent, I think it's very important to understand, yes, there may be athletes, there may be individuals that are struggling, right, that have psychological disorders, that have major concerns that are very disruptive and impactful. However, there's a lot of us that are also in the middle that are just stressing, right, that have the natural ups and downs of life and that sometimes stress out a little bit and they need some guidance and resources to be able to help out with that. And then there's other folks that are striving, that feel very good about life, that are setting goals and achieving them. And so regardless of where you're at on that continuum, psychology and psychological resources have ways of intervening to either bring the struggling back to baseline, to help the stressing to be able to be more managed, or for the striver to actually go forth and execute on the things that they want in life. And so I am happy to partner with child and adolescent behavioral health, and I look forward to answering your questions as they come up and being a resource in any way that I can. So until next time, when we start diving into some questions, my name is Dr. Steve Graef with Mindurance, signing off. We'll talk to you soon.